Some pet owners are looking for more than just an annual exam and vaccines. They're looking for a complete wellness plan to keep their pets as active and keep their quality of life as good as it can be for as long as possible. To do that, we need to take a more holistic approach to your pet's care. Rather than just responding to diseases as they come up, be proactive, evaluate all of their systems, and make sure we know what's happening with your pet so we can optimize their care. So a wellness exam, we're going to evaluate several factors. First of which is probably mobility. We'll look at their strength, how their joints are functioning, is there any pain, any inflammation, how do we maximize their performance and ability to run and play. The second one is probably nutrition. Yes, some animals are overweight and may need to lose some weight, but other nutritional factors. What stage of life are they in? Are there diseases that we can respond to nutritionally? Third one may be looking at other things that maybe the underlying cause for their general disease or why they're not doing well. Underlying endocrine diseases like diabetes or hypothyroidism. 4, we need to take into account what that owner feels return to function it is. If it's a dog that goes for 3 or 4 mile hikes with their owner, it's important that we can get back to that. Other owners would be happy if they can take their dog out for a very short walk, but they can manipulate slippery floors around the house and get up and down the stairs to sleep at night with their owners. Probably the 5th one, it can be the most distressing to some owners, is cognitive dysfunction. Same thing as like Alzheimer's in people. If our dogs start to become nervous, anxious, forget their normal routines, start staying up all night, sleeping all day, we need to address those issues because they have a significant impact on the pet's quality of life and sometimes on the owner's quality of life. So we're going to take into account all 5 of those factors, any other things going on with that pet, and then try to put it all together with a comprehensive plan of how we can get them healthy, back to going for walks, back to enjoying life, and enjoy their life for as long as possible. Once we've evaluated your pet and we know what our goals are and what we're trying to achieve, we're going to enlist the help of some of our rehab technicians at our rehab center to see if we can achieve mobility, strength, balance. So we use things such as our underwater treadmill, get them in the water, walking against the resistance of the water on an underwater treadmill. We'll build strength, build coordination, help them with mobility. Outside of the tub, we're going to use cavaletti rails, which are rails they step over to work on coordination and flexibility. Even harder are things called commando crawls, where they're going to crawl underneath things that look like hurdles. Really work on flexibility and strength. For core strengthening, we'll use balls. They're called balance balls. We'll actually stand the dog, sometimes just 2 paws on the ball, sometimes all 4 up on the ball, working on their core strength and their balance. It's amazing the results we can see with some dogs that we thought maybe weren't really going to be able to walk much anymore. Now we've got them walking, doing stairs, going out for walks with their owners, and really enjoying the freedom of that mobility. Another therapist that you may work with is a nutritional therapist. Oftentimes we're making poor choices nutritionally for our pets. If we can take weight off, improve their overall health through nutrition, less medication we need for those conditions that we're treating, and ultimately better for our pets. If at the end of a visit with your veterinarian, you feel like there's still more things that need to be covered, still more issues that need to be addressed, it may be time to consider calling the Animal Wellness Center, speaking to one of our veterinarians or one of our rehab technicians, and scheduling a visit. Come in, we'll spend an hour, evaluate what's happening, and see if we can come up with a plan to improve quality of life for yourself and your pet, and hopefully keep them around for a long time.